There was a lot of technical innovation to improve on the fundamental method that was available at the time for sequencing DNA. And there was greater accomplishments in incremental improvements, evolutionary improvements of the existing method. What has transpired is since 2003, we have achieved the ability to sequence a human genome for less than $1,000. That is more than a million-fold reduction in the cost of sequencing human DNA or any kind of DNA since the end of the Human Genome Project.
Welcome to UnNatural Selection, a show about competition, innovation, and the strategies shaping tomorrow's frontiers. I'm Nick Encina. Each week, we speak with pioneers shaping the future.
This is episode number 7. Today, we go all the way back to the blueprint. Genomics reshaped how humanity understands itself, and the Human Genome Project wasn't just a scientific milestone. It was a competition, a collaboration, and a test of how large, global systems respond under pressure. In this episode, we look at how public and private forces collided, how governments intentionally structured competition to accelerate progress, and how managing risk, rather than eliminating it, changed the future of medicine. This conversation shows what happens when innovation is treated as a system, not a miracle. Our guest is Dr. Eric Green. Dr. Eric Green is a genomics researcher, Human Genome Project participant, and former director of the National Human Genome Research Institute at the U.S. National Institutes of Health. He was at the Institute for nearly 30 years, during which he directed an independent research program that included integral start-to-finish roles in the Human Genome Project. Dr. Green earned his MD and PhD degrees from Washington University in St. Louis. He has authored and co-authored over 395 scientific publications. He was elected to the National Academy of Medicine in 2023. Let's go.
Dr. Green, it's a pleasure to have you here. Thank you for being here.
Well, Nick, thanks for inviting me. It's a pleasure to join you today.
And obviously we both spent time at Washington University, which we'll get into, in St. Louis. Both of us are part of the Human Genome Project, so I'm eager to unpack that because I definitely get a lot of questions about that. But before getting started, the general question I ask everybody, just to kind of set context, is what business were you in, and what was your role within that business?
Absolutely. And of course, people might interpret business in different ways. Being in the federal government, I would maybe use the word responsibility as synonymous with business. But what the responsibility we had at the National Human Genome Research Institute was basically to lead genomics research for the country and in some ways for the world. Now, let's unpack that a little bit, make sure people listening to this know what genomics is. So all the DNA of an organism is the genome. The word genomics got first coined in 1987.
Actually, can you pause? For some reason, you broke off for a second. I don't know if it's your speaker.
Is there something wow, that's interesting, because we were chatting before and we didn't break up, should I turn my speaker down a little, the volume? Because I don't need much volume.
Do you have headphones by any chance?
I do. This is a new laptop, so I wasn't sure how well the headphones would work.
All right. No, we can. Well, I think what it is the feedback. Sometimes, like the speaker and your the speaker and your microphone and your computer will interact in funny ways. But
I turn the speaker way down so I can still hear you, but maybe they won't interact. Do you think it's better now?
Yeah, let's try it now. Let's try.
So, if it's a problem, I can go and try to get some headphones.
Okay. So let me ask you a question again so you kind of get in the flow.
Yeah.
But it was just a very noticeable. It wasn't like a tiny one. It was like when you said a whole word, it disappeared.
Oh.
Yeah.
We don't want that.
Especially in the start. Okay. So Dr. Green, it's a pleasure to have you here. Could you please let us know what at the NHGRI, what business would you characterize what the NHGRI was in, and what was your role within that?
Yeah, I guess the use of the word business is not always the one used for government work, but I get what you mean. It's basically what's the responsibility that we have at the National Human Genome Research Institute, and my role in it when I was there for 31 years. To help set a context, it's probably worth making sure everybody knows what genomics is, since the responsibility of the Institute was to lead genomics research in the country and really for the world. A genome is all the DNA of an organism. And the study of a genome is the field of genomics. It's actually a relatively young field. The word genomics was actually coined in 1987, happened to be the year I graduated medical school. That happened because this new field was growing rather rapidly, because the tools for studying DNA had improved so much throughout the 1980s that the idea of comprehensively studying all of the DNA, the genome of different organisms, sort of seemed to be possible. And that led to the launching of a field in 1987 called genomics. And it was quickly thereafter led to the launching of this big project, which I know we're going to talk about, called the Human Genome Project. Now, the National Human Genome Research Institute was originally created by the US Congress in 1989, first as an office, later as a center, eventually got named into an institute. And it was created specifically to lead the NIH's, the National Institutes of Health, efforts in the Human Genome Project. And the Genome Project ran from 1990 to 2003. And ever since 2003, I would say the business that NHGRI, the National Human Genome Research Institute, is in is leading human genomics research, both in the United States and around the world. Now, you also asked me what I did. And in my 30 years plus years there, I did a number of things. I came in as basically an independent investigator working on the Human Genome Project. When I got recruited there in 1994, I had started working on the project from day one in 1990. But then over the years, I basically took on various leadership roles that that I was given. And then in 2009, I became the director of the Institute. And I was until March of this year, 2025. And during that time, what I would say is we expanded the field of human genomics, built on the successes of the Human Genome Project. And many, many technical innovations happened along the way, but perhaps most important to stress is that we began to see genomics being used in the practice of medicine, something that's often referred to as genomic medicine, which I think ultimately was one of the most fundamental goals of why the US Congress wanted the National Institutes of Health involved in the Human Genome Project, was to explore and eventually realize health benefits of genomics.
That's great. And could you share a bit about your personal journey to genomics? Because when you started this, this was early on. This was a Human Genome Project. This was before that. It wasn't as an established a field as it is today. So, what led you into this field and eventually being a part of the Human Genome Project?
Yeah, I mean, it's a fortuitous way to get there. I always say a lot of this is luck and maybe a teeny bit of ideas of what it might lead to. As I mentioned, the word genomics didn't get coined. It didn't exist until 1987. And 1987 was when I graduated with both an MD and a PhD. So it's not like during graduate school or medical school I ever heard the word genomics once, because the word didn't exist. But, I was a very curious young physician scientist, and looking around as I decided first to do training in clinical pathology or laboratory medicine, which is the half of pathology that runs the diagnostic laboratories in the hospital. And I will admit that when I was an intern in laboratory medicine, I got particularly interested in some of the DNA-based testing that was becoming available to patients, but very, 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 very simple. Now we look at it and it's just so much more expansive than what it was then. And one of the nice things about doing a pathology residency is you get to do research as part of the residency. And so by 1988, it came time for me to find a postdoctoral fellowship at Washington University. And I had really never done any DNA-based research, even as a graduate student. I was a cell biologist and a biochemist. And I thought this seemed like a very opportune time to get some skills in this new field of genomics. So I gravitated to one of the founding fathers of the field and one of the early conceptualizing architects of the Genome Project, someone named Maynard Olson. I became his postdoc, and really the rest is history. I was afforded the opportunity to be in the right place, the right time. Washington University got one of the very first centers that was going to be involved in the Human Genome Project. Maynard Olson put me on the front line, said, you run the project as a postdoc. So there I was, literally on day one of the Human Genome Project, participating in it, thinking I was going to maybe stay in academia for a long time. But by 1994, I got recruited to come to the NIH by Francis Collins, who was then the director of the Institute, and to be an active researcher there, and then eventually lead all the on-campus research that goes on, that position called the scientific director. And then, and eventually when President Obama became the president, he appointed Francis Collins as the NIH director. And in turn, I competed for and was selected to be the NHGRI director, where I served for about 15 years, a little over 15 years, until just a couple of months ago.
Very fortuitous indeed. The way I ended up there was similar winding path. I was actually in stem cell biology as well, so that's what I was doing in grad school. And I wanted to go into computational biology because the Human Genome Project was going on, and it was really looked like an emerging field. So I went to Washington University to get my degree in computer science. And while there, I was recruited over to work in the Warren Gish lab, the blast lab at WashU. And so I wasn't necessarily seeking that, but the opportunity came up and I ended up there, and I look back fondly at my times there because it really was kind of, it felt a little bit like putting the tires on while driving the car in many ways,
Well,
especially in the
that's how
computer
the whole
science.
Human Genome Project felt like. I always refer to it as trying to build the airplane as you're flying it. I mean,
Yeah.
it was quite a ride. By the way, in reminiscing about that, journey that I experienced, I really can't stress enough that there was a lot of fortuitousness here. If you would have asked me in 1988, when I made a decision to do my postdoctoral research in this new thing called genomics, because I was interested in I was a physician scientist interested in diagnostics and diagnostic testing. If you would have asked me then that in my lifetime, we would be able to completely read out a patient's genome and use that as part of their medical care, and maybe even do it within a day or two, the way we're doing it now for acutely ill newborns in neonatal intensive care units, I would have said, no way, no how. We don't even know how to sequence one human genome. How are we going to do it for a diagnostic test in 24 hours? Actually, if you would have asked me that even in 2003, when the Human Genome Project ended, I would have said, oh, this will come near the end of my life. The fact that all this happened, not only in my lifetime, in my professional lifetime. And I just feel so fortunate because it actually all happened, while I was actively working at the National Human Genome Research Institute, including being the director exactly at the time when rapid newborn sequencing sort of came to the fore because of a research program that we launched shortly after I became the director. So it's been a very gratifying, albeit somewhat fortuitous, little lucky, but wow, is this happening faster than I ever could have anticipated?
Yeah. When I was a part of it as well, it was very researchy, and I could have never anticipated it going as fast as it did. And my life kind of wound up back in it because then I went into biotech. I start biotech companies, software companies, and then at Ariadne Labs and Harvard School of Public Health, helped co-found the Precision Population Health Program, which is really kind of just bridging precision medicine onto public health and primary care. And then eventually I ended up starting with Dr. Robert Green, the consortium, the ICONS consortium, which brought me right back into genomics and into newborn screening. And so it's a very full circle for me, starting in the Human Genome Project, now leading this consortium, trying to get it at population levels. But it's,
Nick, I think both of our stories illustrate an important point. And certainly, if there's any young professionals listening to this or trainees listening to this podcast, I spent a lot of time talking to trainees, especially over the last 15 years when I was the NHGRI director. And I think a lot of young scientists, a lot of physicians, a lot of physician scientists, they think that those of us who have sort of progressed and had a lot of successes associated with our careers, that we had it all mapped out in a very linear way. We knew exactly where we were going. We knew the exact steps we were going to take, and there was not going to be any looping. And it's just the furthest from the truth. And I think both of our stories really show that you can't anticipate, that there's no master plan, and that new opportunities constantly arise. And some you ignore, some you say, not for me. And some you take, and sometimes you take the wrong one, and then you jump into another one. But many cases you take the right one, but it's not predictable. And anyone out there who thinks that anybody who goes on these journeys where there's been many twists and turns knew what those twists and turns are going to be up front, it's just not true. And so don't worry about not feeling your 30, 40-year professional master plan. None of us had a master plan. We just simply came to forks in the road and we went one way or the other on multiple occasions.
I totally agree. And in fact, the winding path often leads to opportunity too, because you can find yourself downstream in something like genomics, but then you come across a challenge and you remember how you may have come across that in a different world, in arts or in music or any kind of jobs that you had beforehand, and it allows you to kind of bring those solutions to bear in the field that you're in. And so I find that divergent thinking and lateral thinking really helps in whatever area you're in, and the more that you enhance it, the way that you enhance it is by exposing yourself to different things to begin with.
And don't lock in. I mean, I think a lot of young people want to lock in and then just sort of, go through with the locked in plan. I think it's the worst possible thing you could do.
I totally agree. So you mentioned WashU was one of the first centers in the Human Genome Project. And of course, all the centers that were a part of this, they all compete with each other. They for grants and for publications and for discoveries and for people. Yet the Human Genome Project is often seen as a monumental scientific achievement with a collaborative of all these centers that typically compete. And so, can you share any behind the scenes stories about competition between the centers? In a second, we'll get into Celera. I remember that was very clear. There was a private public, but if we just focus on the public for now, how did the centers relate to each other when fundamentally they kind of competed, but now they're all thrust into this project working together to evolve an initiative that affected all of humanity?
Yeah, I mean, there's a lot that's been written about it. There's various interviews and group discussions. If people go to YouTube, I can tell you there's a lot of assets out there if you want to have a deep dive into some of this. What I will tell you is that one of the reasons why the Human Genome Project wasn't totally popular among everybody at the time that it was conceptualized and launched was because everybody knew it was going to be unconventional for biomedical research. I'm not sure everybody appreciates the fact that back in 1990, it was very unusual to have big science, to have big consortium, to have a very highly managed, production-oriented scientific endeavor. And that's exactly what the Human Genome Project was. Now, that's become much more commonplace. And even since the end of the Genome Project, there's many, many of these examples where consortiums come together. They both have to collaborate and compete at the same time. But in particular, what NHGRI has demonstrated going back to the Human Genome Project is that there is a way to do this at the NIH. And it required using funding mechanisms and a style of government-based funding that is not always used, but it is absolutely in the toolbox available, and it just has to be done in a very specific way. So what do I mean by that? Almost all of the Human Genome Project funding provided by the NHGRI and similar to other consortium in genomics that have followed are not done by the conventional research grants that NIH funds in bulk, but rather they're done as something called a cooperative agreement. And a cooperative agreement is basically what the title sounds like. It's basically, yes, groups compete to be part of the consortium, but once they are funded as part of the consortium, it's a cooperative agreement that the government is at the table as equal partners with the scientists constantly, almost on a weekly basis, molding what's happening, shifting money as needed, shifting priorities, changing things. It's not about scientists getting money, going off and doing things and then reporting back to the government. The government's on the phone. Back then it was phone. Nowadays, of course, it would be, maybe Teams or Zoom or something like that. But this is done in a highly cooperative way. Now, there's sociology involved, right? So yes, you have these groups coming together that are about every 4 or 5 years have to compete with each other to figure out who's going to be part of the consortium and how much of that money do they get. they also have to cooperate.
Mm.
And it's never easy, and it involves a lot of diplomatic management, and that's where the government staff comes in. In some ways, you asked me early on, what's the business that I'm in, or what's the business I was in? What's the business of NHGRI? I mean, they are funding the work, but they're also molding the scientific programs and they're conceptualizing them, often, almost always in collaboration with the scientific community. But then they have to manage it, because especially these big, audacious programs require a lot of week-to-week management, and a lot of hard decisions, and that's some serious work.
Yeah, and if we think about Celera, the biotech company that was kind of racing the public initiative to sequence the genes. The big fear there was that they were going to patent the genes and block the research, and all of the experimentation would come downstream. Uh, and I was fairly junior. I was in grad school at the time in the Human Genome Project, but I remember having this vision of Celera being kind of like the Borg, or the dark side. But in retrospect, that race probably stimulated a sense of urgency on the public side as well, right? So, can you talk a little bit in hindsight? Did the rivalry between the Human Genome Project team and Celera help or hinder the progress in getting the project done?
Well, first of all, it certainly created a lot of turbulence. I mean, what I would say is, the Human Genome Project was trying to figure out exactly how to build that airplane, even though we were already flying it. And there were multiple ideas that were being tested out on exactly the optimal way to eventually map and sequence the human genome. Celera came around with, technology that allowed them to go faster in certain ways, and did represent a threat to the very existence of the Human Genome Project, but also it threatened the fundamental ethos of the Genome Project, which was to share the data widely, not to commercialize it, not to put up any toll booths in getting access to information about the genome. This is humanity's genome. It should be freely shared. And that was at the core of what was driving those of us working on the Human Genome Project. That gets threatened, then all of a sudden you say, all right, maybe we can't be exploring 3 or 4 different ways of mapping the human genome. Maybe we now just got to decide on one and just go for broke. And, there's nothing like a common threat to bring a bunch of scientists who might otherwise be intellectually arguing about a lot of things. You bring them together, because you realize if we don't all focus and work together, we will be threatened by this alternative model, which is to privatize the human genome. And that just became a galvanizing motivation. And ultimately it won the day, because we were able to get it done. And it was also very clear that there was only one model going forward for getting a finished human genome sequence, which was very tedious and very expensive. And that was going to be the Human Genome Project, which is why after Celera created their draft sequence of the human genome sequence in parallel with the Human Genome Project, they sort of faded away, because there really wasn't much of a business model, considering the Human Genome Project was going to provide the human genome sequence for free.
Yeah,
And
open
so
source it.
it did speed things up. I think most historians and most of us involved realized it did. The project was originally slated to take 15 years. It finished in 13 years. But it really did galvanize everybody to just start rowing in the same direction.
You and I were obviously at very different roles. From your purview, you're much higher. The leadership at the Human Genome Project use that as a way of motivating the people within the project to work harder. As you were talking about that, I was reflecting, and I remember feeling a sense of urgency. Like, whatever I need to work on, I need to work on it fast, because we have a competitor that's trying to do the same project but in the wrong way. So was that intentional, or was that just a byproduct of the competition?
Oh, I mean, it was a byproduct. I mean, I don't think anybody in the Human Genome Project wanted the competition per se. But it is what it is. It was what it was. You had to deal with it. Celera played it hard. I mean, they played it hard, and there's a lot been written about it. They wanted to get the Human Genome Project to move on to other organisms and to forget the human genome and work on the mouse genome, for example. And that was just not a tolerable idea. And so it became absolutely all hands on deck. And again, this is where it being a cooperative agreement, Francis Collins was essentially by the way, this was not just the NIH. I mean, I should probably make sure everybody realizes this was the Human Genome Project was an international effort. At the end of the day, there were 5 major groups that were involved. There was a series of additional groups, but it was from multiple countries. But Francis Collins, as the director of the NHGRI, was sort of the field general, if you will, but he worked closely with the other funders. But they were on weekly conference calls, and the way it was organized, and everybody agreed, is like, all right, this is what we're going to do. And he, on a weekly basis, figured out what everybody was producing, whether they were coming up with the totals that they said they were. If they weren't, they would shift resources around, either money or clones or materials. And it was all out. It was all out at the end.
Mm-hmm.
And then it required some diplomacy to make sure that nobody would lose face. That's when President Clinton got involved, because it was not a good value to have the government beat up on a company, nor was it good value to have the company make the Human Genome Project look unsuccessful. And so, at least for the draft sequence, which was not the final one, just the draft one, was this big event at the White House where President Clinton basically declared it a draw. And so everybody could get credit for getting us where we were. And then the Human Genome Project put it across the finish line a few years later.
Yeah, part of the diplomacy you were talking about before, part of the government getting all these centers that typically compete to all work together in this collaborative.
Well, that's right. There was that. Well, first of all, I mean, you are right. There's concentric circles of diplomacy. I mean, one was getting the NIH funded centers to work together, because that's exactly the money that NIH could control. Then you had to get all the different groups funded by different funders. I mean, there was a Department of Energy group that was funded. There was a group in the UK, the Wellcome Trust, and then there were even some other groups. So then you had to have scientific diplomacy around the world. And then you had to have the diplomacy, which is where President Clinton and Tony Blair came in, to get Celera and the Human Genome Project to agree to a sort of a tie for the draft sequence.
Yeah, it's fascinating. And so when you think about that level of coordination, and we talked about the role that NHGRI played, especially underneath the NIH, there is a significant amount of direction that the government plays in stimulating innovation in fields. And if we think about just genomics, obviously one of the logical ways is through grants. You put out these grants, you say this is the field, the kind of work that we're interested in, and then people submit for those. Can you reflect upon your experience a little bit in driving innovation in genomic research, especially in a field that was developing as fast as this, right? When you're like at the drawing board thinking about what grants you're going to put out for that year or for that portion of time, how do you, there are so many different directions so you can choose to put your money, but there's a limited pool of money. So how did you choose which direction to stimulate innovative work in genomics?
I mean, it is one of the most important things NIH has to do all the time across all the institutes, all the areas of science. I think there's great stories to tell within genomics, because as you point out, genomics has been driven by technical innovation. And the role of NHGRI is to stimulate those kinds of technical advances. I think let's focus, because I think I can illustrate some really important points if we just focus on the sequencing of DNA, because there's 2 stories I'll tell you. And sequencing DNA is reading out the order of the building blocks of DNA. And within that order of all those building blocks, the G's, A's, T's, and C's in DNA is encoded all the information necessary for life, essentially. When the Genome Project began, nobody ever thought we would sequence the human genome using the then available fundamental method for sequencing DNA. In fact, for many years in the Genome Project, the first 4, 5 years, 6 years, the Human Genome Project, there was a lot of attempts to make innovation, better ways of sequencing DNA. And they said, we won't start sequencing the human genome until we have an all new method or methods for sequencing DNA. That was the mantra. Meanwhile,
there was a lot of technical innovation to improve on the fundamental method that was available at the time for sequencing DNA. And there was greater accomplishments in incremental improvements, evolutionary improvements of the existing method that ended up outstripping the development of any all new method for DNA sequencing. So one of the surprises of the Human Genome Project that's been extensively written about is at the end of the day, the fundamental biochemical method that was available on day one of the Genome Project was the fundamental method that actually sequenced the human genome for the very first time. And that was surprising. So that's a story of technical innovation where it was incremental that eventually led to like a revolutionary improvement in how we could sequence DNA. Here's the however, which leads to the story number two. Because the however was, while the Human Genome Project was successful, and in April of 2003 declared they had sequenced the human genome for the first time, it came at a price tag that was money well spent, but it was $1 billion roughly. So sequencing that first human genome cost something like $1 billion. And the reason why this brings up story number two is because the day the Human Genome Project ended, NHGRI, in doing its business of leading genomics research, published in the journal Nature a new vision for genomics research, starting with the completion of the Human Genome Project. And we said a lot of things. There was like 20, 30 major points we made in that paper. I was one of the co-authors. But as the pathologist, somebody thinking about diagnostic tests, I was involved in crafting a really important sentence in that paper, which talked about how, while we should be very proud of having the first human genome sequence, $1 billion is a little expensive for a clinical test. And I was the one that pointed out, a reasonable diagnostic, a blood test or a really good comprehensive diagnostic test of some form really needs to be more like $1,000. And we put into print in this new strategic vision published in 2003, the call for developing all new technologies that would eventually get us to the point where we could sequence the human genome for $1,000 or less. And that phrase, the $1,000 genome, became well-known and a battle cry for the entire genomics community. And I would actually contend that what started in 2003 in terms of new methods and all new methods for sequencing DNA represents one of the most impressive accomplishments in technical innovation ever supported by the National Institutes of Health. There are others, but I can tell you this is certainly in the top few, because what has transpired is since 2003, we have achieved the ability to sequence a human genome for less than $1,000. That is more than a million-fold reduction in the cost of sequencing human DNA or any kind of DNA since the end of the Human Genome Project. And you may ask, well, how did you get there? And I would tell you there were two things that were instrumentally important. One was we weren't the only ones involved. The private sector got very excited about this, and a lot of companies started to develop, and they got in the game and they waited for academic advance. They did some of their own research, but they also waited for some academic advances that came out of the other key factor, which is NHGRI launched a technology development program. And it was called the $1,000 Genome Program. And it was basically an attempt to stimulate all new approaches for sequencing DNA. And the way we did it, and I can't take total credit for it, I wasn't the director back then. I just got to watch from the 50-yard line, had a really good front row seat, is that they didn't just tell people go off and figure out new ways of sequencing DNA. They put out different kinds of funding competitions. One that called for a little improvement in sequencing and reduction costs. Another one that was a little crazier that would reduce the cost even substantially. And then they even called for really crazy high-risk ideas where they knew that 90% of them would fail, but just bring us some crazy idea. And they funded them separately, and they didn't let them compete with each other. They had different bins so that the groups that were a little more conservative would compete with each other. Those in the intermediate group would compete with each other, and the crazy ideas would compete with each other. And you know what? They all bared fruit. Every one of those categories incrementally gave you something along the way over the multiple years that program was funded, and the rest is history. And thank goodness the private sector was there standing by, grabbing the advances, grabbing the patents, getting royalties. And now, as you well know, we have multiple new methods
for sequencing DNA. These are all called next generation sequencing methods, and the innovation continues even to today. But we achieved the goal of the $1,000 genome a number of years ago, and it has been transformative across all the life sciences and increasingly in medicine.
Amazing. The way that the federal government can stimulate not only research but technological development and generation of ideas, right? You come up with, here's a problem, here's a bundle of money, we're willing to pay for it, and then you throw it out there and you just draw all these the greatest minds in those fields to just come up with solutions. Like you said, the wildest ideas. We just want to see what crazy ideas are out there, see what works, because you never know which one is going to work or what derivative of that initial attempt might actually work. And when you're thinking at that level, at a very high level, throwing around very large dollars, it's amazing how you guys have effectively shaped the course of genomics, and to your point, gotten us here in 22 years, to the point that we've gone from a $1 billion genome to sub 1,000. And now people are talking about using it. Well, they are using it already in clinical levels, obviously, in specialty care and in other areas. But now when we start thinking about it as a screening mechanism at population levels, we're almost there. And it's just been just over 2 decades. It's incredible.
Right. And, I also want to stress one other thing. I think sometimes people think like, the government's over here and they're not talking to people and they just throw out ideas. And I, I can certainly tell you that's the furthest from the truth. I mean, throughout all of this time, NHGRI and its staff and its leaders like me, we are constantly talking to the community, and we're even talking to the companies. I can tell you that as the price of DNA sequencing started coming down and these companies started popping up that had all these new technologies, I would frequently talk to the heads of these companies and I would say, what do you need next? What do you need that you're not doing in-house? Because they're, of course, doing their own R&D, but it was such a wonderful collaboration because they would say, this is the kind of stuff that is a little too risky for us. We'll take it and we'll commercialize it when it gets to this stage. But what we really need is some innovation in such and such. And they would give us, ideas. And then it was a constant back and forth. And I take a lot of pride that I think NHGRI was highly contributory to the achievement of the $1,000 genome. But I immediately always point out that we did not do this alone. And it was a beautiful example of a lot of discussion, collaboration, strategizing between the government and the private sector. And that even continues to the present time. And it's a really healthy ecosystem and a great way to see technical innovation where contributions are coming from both the government, from academia, as well as from the private sector.
Well, I would be remiss to if I overlooked the opportunity to ask, because we talked about the original stimulation of genomics back with the early research and then the Human Genome Project leading up to the funding that stimulated the development of platforms and the science to get us to where we are right now. Projecting forward, where do you think the government is going to play the biggest role in leading genomics from here on out? Obviously, we have things like CRISPR, gene editing technologies. There's a lot of really exciting stuff happening on the ground, both at the private, the research, and the public level. But when you think at that level of the NIH, NHGRI, what do you think what direction do you think NHGRI will be pushing the research and technological development over the next 5 or 10 years?
So, Nick, it's obviously a complicated question that has personal implications for the way I even answer it and think about it. It's been a rough 2025 for NIH. It's been a rough time for NHGRI. I retired from federal service. I didn't want to. I wasn't given a choice. And so and 5 other institute directors have similarly been removed from their leadership positions. There's a lot going on with the new administration. It's very complicated, and a lot of reduction in our workforce, and a lot of threats budgetarily and other things. So NIH is not in a healthy state right now. I'm in mourning watching what's happened to an institute that I was at for 30 years, where I can tell you that many of the things that we've spoken about that have led to these successes, there really is no longer the complete apparatus at NHGRI to continue doing some of those things. Now, it's not that it doesn't exist. We got money, I mean, et cetera, but there's a lot of parts of the institute, multiple parts. I could tell you 3 or 4 parts where all the people have basically been terminated. So I'm going to answer the question, assuming a future where NIH and NHGRI rebuilds to at least something resembling its former self. If we don't turn this around, then I can't speak to what NHGRI will do. That said, I think the genomics advances of the future are not just going to be NHGRI funded. So I have a lot of faith in the world. I have a faith in a lot of organizations, private sector in the United States, other funders in the United States, and there's a lot of incredible innovation going on in genomics around the world. And when it comes to medical applications of genomics, in some ways, other parts of the world are surging ahead of the United States, in part because our healthcare system is so complicated that it's not exactly the greatest place in the world to do some really important studies in genomic medicine. Other countries that have single payers are able to go a little faster. So I am generally optimistic that genomics will continue to surge ahead. And I want to be optimistic that NHGRI and NIH is going to rebuild, heal all the wounds that have happened of late. And NHGRI will eventually get a new leader and hopefully the budgets will be healthy and maybe some of the functionality we've lost will be able to get restored. I truly believe that given a positive rebuilding of NIH, there's a lot to be done, and NHGRI, importantly, supported by an incredibly wonderful, talented, interdisciplinary genomics community, could continue to lead and see some pretty remarkable things in the coming decade. In 2020, in the middle of the pandemic, we published our latest strategic plan, which really charted a course for what we call the forefront of genomics, really the cutting edge of genomics. And it was basically a nice blueprint for what NHGRI thought needed to be done in the coming decade. I do think some of this is being slowed down now. So I think we're going to lose a little of our momentum. But once we can get that momentum back, there's a lot of really good ideas that still remain to be tackled and a lot of things that are ongoing that are the right idea of what needs to be done. And by the way, when I say done, I mean, this is at the technology level, at the basic science, understanding how the genome works, at the translational level, understanding how the role that genomics plays in human health and disease. And then, of course, actually using genomic information as part of medicine and implementing genomic medicine and precision medicine. So I know that our strategic vision that we articulated in 2020 is still quite fresh. I think probably within another few years, maybe we're probably going to need to renew that because I do think there's a lot of developments that, and you mentioned some of them, including some incredible advances now going on in CRISPR-based therapeutics that I think we'd want to really even push harder on the accelerator. So I think there's a blueprint for continued incredible advances in genomics. I think you're going to see this. We'll see it maybe a little more around the world than in the U.S. until the U.S. gets their act together, get NIH healthy again. But I'm very optimistic. And I really want to, once again, really stress the incredibly productive and cooperative and altruistic members of the genomics community, both in academia and in the government and also in industry. I think there's really a shared vision and a vision of excitement that will win the day.
I totally agree. And for the record, when I talk about the U.S.'s strategy going forward, I also look at it from the perspective of a healthy NIH and NHGRI.
It has to be.
It has to be. And so, but it's an interesting concept. And when we talked about competition internally to the Human Genome Project and also with Celera, over the last decade or so, in recent years, China has been investing heavily in genomics. And here, while we're going through this phase where we're withdrawing from investing in the kind of R&D that's always made the U.S. so competitive, and like you said, other countries right now will have to take on that torch of advancing genomics But one of the challenges with that is that they don't always share the data and the results that they learn, right? So if it were all open source, it's like, okay, we're going to take a pause for 4 years. UK, China, you guys lead the charge, and let's just make sure we all benefit from this. But it doesn't work that way, right? And I mean, there's the obvious privacy constraints around human genetics, but then there's also just the competitiveness. And so that to me is a concern around the U.S.'s standing as a global thought leader in a field that's so critical to all of us, which is genomics and genomic medicine, especially as we start seeing China investing so heavily, coupled with the fact that China is also not constrained to the same kind of regulatory or privacy w- guidelines and laws that we have, right? So for them, it's almost like there are no stops. Now it's just put, the foot to the gas, go as fast as you can while we're over here sitting in pause.
I agree with you, and I do believe that key politicians, especially members of Congress, many of them understand this, and I do think the competitiveness with China is a very important one, and I'm hoping that will help buffer any calls for significant budget reductions or other harms to NIH, because otherwise we're going to cede our international leadership in biomedicine. And I will tell you, and every opportunity I'm given, I remind somebody who's in an influential position, the number of studies that have been done showing that the return on investment, particularly in genomics, since the beginning of the Human Genome Project has been astonishing. In general, there's good return on investment with the NIH funding, but in particular in NIH funding of genomics, study after study has shown a remarkable return on investment. And we really shouldn't cede our leadership, and we are at risk of doing that. And China's probably the biggest threat, and I do think other countries are starting to similarly see the ability to invest. And to some extent, I hope those that are willing to share on the international stage do so. And I think we have to continually push an open agenda when it comes to data sharing.
Yeah, I agree. And especially when it comes to the diversity of the type of data, right? I mean, that's always been an issue in genomics to begin with. But if we think about how complex genomics has turned out to be, from my perspective, 20, 30 years ago, we were talking in a very idealistic way, which is once we sequence this, we're going to understand how all the diseases happen and then how we can treat or cure them. And then a decade passes, 2 decades passes, 2 decades pass, and then we start realizing actually, sure, for some types of diseases, more Mendelian diseases, you can say, okay, this mutation leads to this disease. But we're actually finding that genomics is appearing to be more of a probabilistic, a risk stratification tool that you need to take into account along with people's lifestyles, things that they're exposed to, their diets, all kinds of different factors or socioeconomics. And genomics factors into that, plus or minus depending on the type of illness or condition that you're talking about, but it's really not as straightforward. And that obviously is just the very beginning of really understanding how our genomics really impacts our lifestyle and our lifetimes over the course of a human life in a way that's much more complicated than we initially anticipated.
Well, I often joke that there's a lot of successes in genomics, but as the field has evolved, one thing has been very consistent: is it's always turns out to be more complicated than we anticipated. The genome was much more complicated than we ever thought. Non-coding DNA in particular is much more complicated than we ever thought. And the importance of having a lot of genomic data collected from as many people of different ancestries as possible is critical for both generating the sequence and for interpreting the sequence. And so big push to get as much genomic diversity, ancestral diversity, that is, in the data sets that are being generated worldwide.
Yeah. And so if we think forward, and this is the field that I'm obviously very involved in, the translation of the research, the things that we learn on the research side to clinical practice, especially at population levels, when we start using it now for screening for healthy adults, healthy children, healthy newborns, part of the problem there is communication. because thinking about genetics is a very abstract thing. You need to really there's so much behind talking what DNA is, how it's within all of our cells and how it behaves and how it affects us. And so a big part of it, a big part of the challenge has been how do you communicate this to the people that can benefit from it? And in combination with that, how do you fight some of the misinformation that's potentially out there right now? Is this something that you dealt a lot of time thinking about and acting on when you were part of the NHGRI?
I spent a tremendous amount of time. I think we had, first of all, I think it's absolutely central. I completely agree with you. I want to really stress the point that one of the things that genomics has to contend with is it carries with it the legacy of human genetics and eugenics. And as well as scientific misinformation, as well as distrust in general, especially among certain communities about science in general. And then there's even some special nuances in some communities about DNA research in general. Because of that, our institute has always been, or NHGRI has always been, very, very focused on studying the ethical, legal, and social implications of the work. Something called ELSI research for ethical, legal, social implications. In addition to that, we built at NHGRI an incredibly robust communications program and an education program that together really provided an outreach. And much of this related to helping communicate about genomics, helping to improve genomic literacy, and really providing resources for teachers, for educators, for professional societies, and so forth to help raise everybody's boat, because people need to be comfortable with the fundamentals of genomics, and they need to understand a lot of the ethical dilemmas that will be inherent with the use of genomics in medicine. Now, I get a lump in my throat explaining all of this because on April 1st of this year, the entire communications and education group at NHGRI were terminated. So at the moment,
Wow.
NHGRI has no communication staff, no education staff. And I think in some ways we were world leaders in those areas when it comes to genomics. So I'm not just being sort of metaphorical when I say we need to rebuild NHGRI. I'm being serious. I do not understand how we can provide an adequate vision and an execution plan for realizing all of the potential of genomics in medicine if we don't hand in hand think about how we're going to communicate this, how we're going to educate this, how we're going to get the next generation of patients and healthcare professionals ready for this new reality. And at the moment, we were the world leaders at that. And at the moment, there are various groups, but they don't have a leader. And I'm very concerned about it. And I was very sad when that happened.
Yeah, for people that are listening that don't know necessarily some of the technicalities behind this, when there's a big distance between discovery work and clinical practice, especially at scale. And a lot goes into how do you get these discoveries into the hands of clinicians, into the practice within health systems, into the minds of patients. There is translational medicine, there is implementation science, there are a whole bunch of disciplines that go into getting these discoveries into a form, into a productized tool that can be used safely, systematically. There's, training of clinicians, there's education of patients, there's coordination of multidisciplinary teams and health systems, and so on and so on and so on. And and all those things are critical if you're going to be able to apply it at scale and get it to a level where everybody can benefit in a way that's responsible, equitable, and safe. And and so genomics, it doesn't live exempt from that. In fact, it depends on that because again, the field is so complex, it's so abstract, and the science is so advanced that it's not trivial to just get it into the hands of a clinician and say, "Here, use this." And
By
or
the way, if you get it in the hands of the clinician, I'm equally worried about that patient that the clinician's going to talk to. The patient has to have some minimal literacy when it comes to genomics so they understand the language. And we were developing so many things at NHGRI for helping teach fundamental genomic literacy at multiple levels. And all of that has come to a screeching halt.
it's terrible. I actually did not know about that. It's distressing to say the least, especially if we think about now, how do we cope with misinformation? We have
I-
the engine that before was creating the authoritative, evidence based information and communications to the public on what genomics is and where it's going. That's gone. And then on the other side, we have all of this misinformation around science. We see it rampant in vaccines, but in genomics, it's going to be equally as critical and as deleterious. It really poses the question of how, and I don't even know the answer. I mean, before, at least I could postulate how we deal with misinformation when we would have a government organization dealing with the evidence-based information. I don't know how we deal with the misinformation now, given what I just learned about the NHGRI.
No, that's absolutely right. I mean, so we have no defense against this. And by the way, go back to your earlier concept about competitiveness in the world. One of the things I think we were doing quite effectively was getting students excited about genomics and teaching them that you could be involved in genomics by going to law school, by going to business school, by going, to medical school, obviously graduate school, pharmacy school, nursing school. We saw all this. So we were trying to do was to think about the next generation. So we had expertise. And we're not stimulating that now. And meanwhile, I think other countries like China, I mean, they're just gonna train a ton of genomicists, and they're gonna outcompete us.
Yeah, and potentially lure a lot of the talent that we used
There's a
to
lot of that
them.
going on, especially in Europe, trying to lure U.S. scientists there.
Yeah, I can imagine. So if we turn maybe to just forecasting into a future where NIH, NHGRI are fully functional and healthy, um, we're still at the just beginning phases of genomics. I feel that way, and we've come so far clearly as we've spoken about it, but there's just so much that we don't know. What um what do you see as the most promising area of innovation in genomics that would have the most transformative impact in medicine in the next decade or so?
Yeah, I'm not sure I see a single thing. I mean, you can't help. There's some recent news about that came out just last week, a remarkable story where an individualized CRISPR-based technology was used to really probably save the life of a child that otherwise would have had a fatal genetic disease. I think genome editing and genome-based therapeutics has some incredible opportunities. Some of it for rare diseases, but similarly, we're seeing this in certain types of therapies for cancer, cell-based therapies for cancer. I think we're just scratching the surface of some of these therapeutics. It's actually not something that I directly worked in, or really not much. NHGRI only had a small footprint in the therapeutic space, but I sit in awe and seeing some of the technical innovations that are happening around genome editing. And of course, we should also realize that the CRISPR-based method is just one method. Certainly, there will be others, and there's a lot of exciting work being done in developing other genome editing capabilities. I certainly think about a world where we have more and more abilities to use genomic information for prevention, and really making sure that those capabilities match the discoveries that are being made. Um, and thinking about, what does the future world look like? Some of that will relate to health ailments, but some of the prevention will be preventing the wrong medication being given to somebody, or the wrong dose, and a whole field called pharmacogenomics. And so, it just seems that there's a series of bits and pieces of information in various clinical niches that I think are going to slowly but surely build up momentum for the idea of getting genomic information, complete genomic information of an individual early in their life. I know it's something you're quite involved in this idea of should we be taking every newborn, maybe, and sequencing their genome, or if it's not at a newborn stage, some early stage. I really do see there's going to be a tipping point at some point. I don't think it's a matter of if, I think it's a matter of when, where people are going to just recognize that having complete genomic information as a available on call through an electronic means, like an electronic health record or some website, is going to become sort of desirable. I think other countries are going to teach us this first because they're surging ahead and doing some of these studies. But I think the literature just keeps growing and growing and growing of the kind of information that will be useful. And I'm very excited about that future. I think, as always, we have to appreciate that most human health conditions are complicated. It's not all genomics. So I don't want anybody listening to this to think that we're going to be in a position of absolutely predicting accurately who's going to be hypertensive, diabetic, asthmatic, et cetera, et cetera. I fully appreciate there's a lot of physical and social environment contributions. The social determinants of health are incredibly important. But I think there's a lot more attention to those areas as well. And I also, sometimes people try to portray genetics versus environment as if it's competing with each other for attention. And I can tell you at NIH, there's a lot of interest at the intersection of those areas, and a lot of studies that are going on to facilitate research at the intersection of those areas. And we're also entering the other thing I'm pretty excited about, and because it cuts across all this. The amount of data and the amount of data tools, and you always want to throw in artificial intelligence, and of course, and machine learning, and of course, I mean, there's such data sets that are available that I just know there's going to be discoveries that we never could have anticipated, because we're going to use these new computational tools in ways that the human brain just doesn't work as well, and make discoveries. So I just tell young people all the time, it just couldn't be a more exciting time than now to do something that's going to touch genomics, because there's just going to be a lot of developments going forward.
I love that. And for the record, that's the area that excites me the most about this, is really how do you use all the determinants of health. For me, precision medicine, a lot of people hold it effectively a synonym for genomic medicine. And in a way, genomic medicine has been leading the charge there because of the amount of data that we've been capturing. But the reality of precision medicine is how you use all of the data available to be able to gather a much more precise view of the patient, where they are in their environment, in a way that you can potentially predict their health outcomes and potentially intervene when you see something negative happening. And so, to your point, as we're gathering data, not only in genomics, but more in socioeconomics, environmental factors, how behavior factors into this, and obviously genomics and heredity. I think as we apply now this layer of AI on top of that to start understanding the relationships, these very complex longitudinal relationships that are just not very intuitive, I think it's where, for me, where medicine starts becoming really, really fascinating.
No, I agree with you. I always describe like a Venn diagram. Genomic medicine is within a circle, the bigger circle being precision medicine or personalized medicine or individualized medicine. But, genomic medicine is a subset of that, because that's giving you information about the genome, but there's all the other information about people's lives.
Yeah. So just to close off, a question you mentioned of young minds right now thinking about the future of this, and you talked about various different technologies from CRISPR to AI. If you could give advice to future innovators in this field, in the direction that genomics is going and all the opportunities and challenges with it, what kind of advice would you give to, say, college students right now, saying like, wow, that what Dr. Green did with the Human Genome Project and NHGRI, that's very cool. I'd like
Yeah.
to model my future in that direction.
Yeah, I would, I do talk to young folks all the time at different levels, and I would, I usually give 3 bits of advice. First thing, and the first two are interrelated. First thing is don't worry so much. I always tell, I think younger people these days, they look at the world, because the world's a crazy place right now, and they just get worried. And I do think, we have some challenges right now, at least in the US, but just look at the successes of genomics, look at the community, look at the people who have built this field. And there's a big tent, and don't worry so much, and please come into our tent. The second thing is something we touched on earlier but come into the tent, but don't worry about all the micro details. Just get excited about something, and don't worry about your exact path, your exact journey. Just, if it doesn't feel right, shift a little. And if it feels right, go for it. And don't let people dissuade you if you're really enthusiastic. The most practical thing, I guess I say, and maybe it's just a reflection where I feel that if I was a student again, what would I need is what we were just talking about. I mean, genomics is data intensive. It wasn't that way when the field got launched. It wasn't even that way when the Genome Project ended, when we had one human genome sequence. But nowadays, if you're going to do any serious genomics research, if you're going to be at the research level or even the genomic medicine level, get comfortable with big data sets. It doesn't mean you just need to be a power user. You don't need to, developing all the algorithms. You can leave that to somebody else. It doesn't have to be hardcore computational work. Just feel comfortable and facile at manipulating large data sets using publicly available tools. Because I think that is just sort of, that's sort of like you just got to know how to, do PowerPoint. You need to know how to do Word. You're just going to need to know how to manipulate big data, because genomics going forward, it is very data intensive, and you're going to have to be comfortable with that.
Perfect advice. I couldn't imagine a better way of ending this. Dr. Green, just want to take a moment to honor and thank you for all of the work that you have done throughout your career, from helping to lead so much of what the Human Genome Project turned out to be, all the way through helping to stimulate and lead the world of genomics for the U.S. and for the world. It's extraordinary, and I'm honored to know you. I'm honored to have interviewed you, and I can't thank you enough for having been here. Thank you so much.
Well, thanks, Nick. This has been a pleasure. It's been great talking to you.
That was Eric Green. Now, Unnatural Signals.
This episode gives us a rare look at how large-scale innovation is actually managed. First, radical ideas need protection. By separating low-risk, medium-risk, and high-risk bets, NHGRI ensured bold ideas weren't crowded out by safer ones. Not all innovation should compete on the same terms. Second, competition accelerates alignment. The presence of a private rival forces coordination, speed, and clarity. Pressure, when structured well, can unify systems that would otherwise fragment. Third, data literacy is now a survival skill. As genomics became data-driven, success depended less on specialization and more on the ability to work fluently with information. Finally, prevention changes everything. Moving from treatment to prediction reshapes not just medicine, but how we think about health itself. Eric shows us that understanding life at its most fundamental level requires the same instincts that help ideas survive complexity.
Thanks for listening to Unnatural Selection. If you enjoyed the episode, subscribe, leave a review, and share it with someone shaping the future. Explore more at unnaturalselection.net and connect with us on LinkedIn and Facebook. Until next time, keep evolving.